Welcome, everyone. I'm Jessica Farringer. I'm the director of the Data for Impact project. And this is our second webinar in a Data for Impact series focusing on health equity in global health evaluation, learning, global health monitoring, evaluation, and learning. The structure of today's webinar is that I am going to give a very brief 20-second overview of the Data for Impact project, the webinar series, and then our three presenters will take over. We will have some time at the end of their presentation for questions. Please put your questions in the Q&A box as we go along. Do not put them in the chat. And another option is at the end, you can raise your hand or open your mic to ask questions. And we will share copies of the slides, and the recording for the webinar will be made available on our website as well. We'll send out all that information to everyone who is registered at the end of, usually the end of today. Okay. So in case you are unfamiliar with Data for Impact, D4I, D4I supports countries to generate new high-quality health and related development sector data, use routine and other existing data, investigate program effectiveness, support adaptive management, and learn from evidence. We also strengthen capacity of country partners to collect, analyze, and use data to support their sustainable development. As I mentioned, today is the second in a series of 5 webinars on equity in global health, monitoring, evaluation, and learning. In September, we held the first webinar, which was on recent health equity focused work under the Demographic and Health Survey, or DHS program, and that is now available on our website under the Resources tab. Our topics for the next 3 sessions are under development and will be announced on our listserv and on the website. If you are not subscribed to our listserv, you can do so from the homepage of our website. We have 3 presenters today. Meg Langley is a senior technical advisor at Palladium and is the Child Protection Portfolio Lead for Data for Impact. Lillian Leghetto is a senior technical advisor and serves as the activity lead for the D4I Counter-Trafficking in Persons, or CTIP, Armenia activity. And Gayan Hovakimyan is a sociologist working with Data for Impact as an expert consultant in human trafficking for this activity. And with that, I will stop sharing my slides and pass things over to our presenters.
Great. Thank you, Jessica, for the introduction. I'm here with Lillian and Gayane, who both work on the D4I counter-trafficking activity under D4I, and we're pleased to share more about the work and integration of health equity in the counter-trafficking space. Great. We'll start by introducing the work of USAID and D4I in Armenia, define terms, go into more detail on the situation of trafficking globally, regionally, and in Armenia, and also discuss in more detail health issues faced by trafficking victims. We will end with a question and answer period. So as Jessica said, please feel free to add any questions, and we will hopefully get to all of them at the very end. Starting off, we would like to recognize the work done by USAID globally and in Armenia in the counter-trafficking space. USAID's counter-trafficking work uses the approach following the 4 Ps: prevention of trafficking, protection of victims and survivors, prosecution of traffickers, and partnerships for strengthened response. The Trafficking in Persons report is produced annually and is the US government's principal diplomatic tool. In Armenia, USAID's country development cooperation strategy includes cross-cutting themes and synergy, particularly in integrating public health and counter-trafficking for a more inclusive, democratic, and economically resilient state. The Data for Impact project started in September 2021 and is a 2-year project. The project uses an evidence-based, learning-centered approach to support the government of Armenia, strengthen, to accelerate implementation of the 2020 to 2022 Counter-Trafficking in Persons National Action Plan, doing so while building practice and systems to promote a sustained national counter-trafficking response in the years to come. So before we get started, we would like to make sure we're all on the same page with some key terms that we're going to be using in this presentation. So first of all, how we define trafficking in persons. You'll see the acronym TIP used, and that stands for trafficking in persons. You'll also see CTIP used, which is counter-trafficking in persons. Trafficking in persons is also called human trafficking, and it is a crime and a human rights abuse. The 3 most common forms of trafficking in persons are sex trafficking, labor trafficking, which is also called forced labor, and child soldering. And the Trafficking Victims Protection Act of 2000 defined severe forms of trafficking as sex trafficking in which a commercial sex act is induced by force, fraud, or coercion, or in which a person who is induced to perform such an act has not attained 18 years of age, or recruitment, harboring, transportation, provision, or obtaining of a person for labor or services using force, fraud, or coercion. So now I'm going to hand over to my colleague Lillian to take us through the trafficking situation globally.
Thank you, Meg. And just to bring to our attention this afternoon, this evening, this morning, wherever we are, that globally the counter-trafficking in person situation has been estimated or even measured in different ways. But for today, we just want to take a glance at the global TIP situation as estimated by the United Nations Office on Drugs and Crime for the report that was published in 2020. And this is data from about 148 countries recorded from national authorities. What came out very clearly for the data up to the year 2018, the number of detected victims were about 49,032. But the granularity of this data stemmed from age and sex. Some were able to report types of number of detected victims for which a form of exploitation was reported, number of persons investigated in those countries, either arrested or reported as at the year 2018, and even the number of persons prosecuted and convicted with the most recent data that these countries provided. And what we can see is the trend is generally from the great number of victims reported, about 49,000, but you can see the number of persons prosecuted. Of course, it's another parameter that we need to think about. Next. So when we look at globally the situation of trafficking in person, we wanted to zero down to this region, which is Eastern Europe and Central Asia, because our work for counter-trafficking actually in Armenia, and we wanted to bring out, so what are we seeing? What is coming out in terms of the regional situation? And as per this, the national authorities that provided data on sex and age, as at the year 2018, only 7 countries in Eastern Europe were able to provide national data with those parameters. And from that data, we say that, or based on that information, where Armenia was one of them, about 46% of the victims were adult women and 38% were adult men. We also see that detection of minors as victims of trafficking remains limited compared to the adults. Another major parameter that we see is majority of the detected victims were trafficked for forced labor. That is about 66%, of course, followed by sexual exploitation. Something very worth to mention is that there was a considerable share of women who were prosecuted and convicted for trafficking in person. And from the numbers out of 66 of those detected victims, 80% of the women were prosecuted who were considered to be perpetrators. And of course, that region is significantly characterized by levels of domestic trafficking. Before we go to the situation in Armenia, allow me to bring into perspective what could be some of the health issues or public health issues that the victims of trafficking do face from time to time. Number one, because of the nature of the crime, the victims who are trafficked either for sexual exploitation or for forced labor or any form of atrocities related to trafficking suffer from mental abuse, of course, coupled with physical abuse. And this is because of the way the crime is done. The persons or the victims end up with a lot of physical injuries, either because of the way they're transported when they're in transit or in the destination points. They end up suffering or getting psychological trauma, and many times even a lot of sexual abuses result from the trafficking in person activities. The other major health issue that we can present is the living conditions of the victims who are trafficked. You find that in many cases, they are living in crowded places. The living condition, they're quite unpleasant. And that brings about exposure to many communicable diseases. There is poor nutrition because remember, these people are bundled either in small rooms. The rations of food they're given are not nutritious. Some of them who are trafficked for labor end up working in dangerous work environments. And of course, some of them are exposed to sexually transmitted diseases. And because of that, we see that their health is at risk, remembering that they're also in another riskier situation of being trafficked or being exploited at the end of the day. So number 3 is many of the victims who are being trafficked or being exploited because of various forms of labor are denied access to emergency health care. If you are having, say, for example, diarrhea, you may not access the emergency health care of that condition. Or even if it is, you've been exposed to an STI, or it could be a victim who has chronic health conditions like diabetes or hypertension. They are unable to access, let me call it basic health care. And because they are denied access to accessing really healthcare services, their health conditions deteriorate even when they're in those perspectives, in those conditions. And lastly, another health issue that we can be able to mention so that we then can discuss how does health equity and trafficking in person then come to play. The last one is the victims of trafficking generally lack health insurance coverage. And I think, as I've said, they will fail to access the most basic care for most of their medical conditions. As a result of this, we see that governments are then being called upon to look into how to integrate the public health agenda in the counter-trafficking sector. But let me give it to my colleague to, first of all, let's see next the compounding factors. What are some of the compounding factors that exacerbate or continue to increase vulnerabilities, including human trafficking? On top of your mind, some of the crises that we can think of include, one, the just, let me call it, ended COVID-19 pandemic. It was one of the crises that really pushed the human trafficking crime to another level because of it was being, the public health measures, there were quite numerous measures that were put in place by government. And as a result of that, we can be able to discuss further how such a crisis presented itself in increasing the crime. Another one could be climate change. Just think about the changes in climate change that we're experiencing right now. We have seen where nations or governments are experiencing drought, a lot of rain, a lot of, say, hurricane, and there's destruction everywhere. And because of that, there are many other vulnerabilities that the general populace faces that can drive the trafficking, the human trafficking agenda a little further. And this is one of among the many things that we need to look into. How do we then curb climate change activities or issues to make sure that then we are able to prevent increase of human trafficking activities. Another factor could be conflicts. We have regional or internal conflicts or border conflicts in various countries. And this is where we see migration happening. People are displaced. People are looking for livelihoods. People lose livelihoods. And at the end of the day, the tendency to increase vulnerabilities amongst certain groups, be it children, be it women, be it the ones who are unable, say, to run, increases further. And this becomes the target groups of the people who are running or who are driving the trafficking in person agenda. Next. Another factor could be, of course, political disputes, and finally, discriminatory practices, even within a country, or policies that then brings about disproportionate, I call it inequalities among the population. You may find that some practices or some policies are bringing inequalities among children, among the old, among the youth. And this can increase vulnerabilities of certain groups that become a target for human trafficking. I'm sure we can think about many other compounding factors, but for the sake of running through in today's session, let's continue. Next. For example, we just wanted to zero down on the possible effects of COVID-19 pandemic on the counter-trafficking in person situation. One is there was less time in public spaces because of the measures that I mentioned previously. And thus, the trafficking efforts went further underground and adapted, say, to the new norm. So COVID-19 pandemic in itself showed, or there were increased trends of these underground activities that continued, and we can see in terms of detected victims that were reported as undergoing through trafficking activities rising. There was loss of livelihood. And this, I've said previously that there was increased or more vulnerable groups that emerged. And as a result, these vulnerable groups become targets of trafficking. Our children were not in school. And in many times, if parents went to look out for their livelihoods, there was limited supervision during the day. They were left at the hands of maybe gadgets. And as we can see, the other effect was increased use of technology, where our children continued to experience or explore what technology was all about during these periods. And as a result of that, the group around children who could be trafficked either for various reasons, even to be exploited for labor, continued to be on the rise. Next. Of course, I've talked about increased internal and external migration. We saw groups of people moving either from towns to the villages or to smaller towns and looking for livelihoods because there was sort of a stop in most of production activities in some countries. And as a result of that, also there was the frontline workers, their focus changed. I could see in some countries like the police officers, the law enforcement officers were forced to move from their, from their points of care to try and contain the movement of people who have been told the curfews is from, say, 6 to 5 p.m., but they needed to move to other points of care to make sure that the general population adheres to the public health measures that have been imposed by a country. And as a result of all these factors, nations tended to have an upsurge of increased trafficking in person activities and exploitation. And for today's discussion, really we want to see then how does some of this situation impact on the health of the people, of the victims? As much as they are in such situations, their health well-being needs to be looked into. What then do we need to do? Allow me to pass it to my colleague Gayane, who will provide very specific discussion points around the situation in Armenia. Over to you, Gayane.
Thank you, Lilian. It's my pleasure to join this conversation and to image our attendees and also cover some questions that you have. Yes, it's very important while considering trafficking as a social issue, a public health issue, and crime, we should consider the situation and the place for the national and regional context. And I would like to come from the fact, as Lilian mentioned, that Armenia within the part of Eastern Europe and in Central Asia, it really affects and the recent, not only the factors, the COVID-19 and overall global issues, climate change, but also the recent clashes, invasion and wars that happened and still happening in the region, nationally and regionally. And that's why that's very important that we, while starting the project, we can consider these factors as profounding factors and also risks for the trafficking. So it is important to mention that in 2020, starting from 27th of September, Armenia, there was a broke out long of the line of contact between Armenia and Azerbaijan, and progressively it grew into a 40 days war, real war, expanding the territories and covering the territory of Nagorno-Karabakh, which is not recognized country and as a not recognized state, mostly populated by ethnic Armenian population. And the ceasefire statement was signed in November. Overall, we had 90,000 of people displaced people after the war, and mostly the whole population moved to the state territory of Armenia. So the official information from Migration Service and also shared with UNHCR that 90,640 people in refugee-like situations sheltered in Armenia, and most of them, 82%, were women and children. Then there was more information that how many percent per the health situation, and we had also proportion of people with special health needs, people with health difficulties also affected by the war. So this is very important to know, because actually the host territories, Armenian communities, of course, welcomed the refugee-like population, sharing accommodation, food, and other available resources. But we also understand that there was a big gap providing in these services to address urgent needs of the affected population, especially taking into account that it was also COVID period and socioeconomically not prepared for the war. So Armenia faced serious challenges in providing and also long-term support to the internally displaced or refugee-like population, including physically, socially, mentally, and financially supporting in long-term aspect. Overall, this is a very important context that should be considered while talking about the counter-trafficking effort, and it is very important to consider that when talking about globally, that border conflicts and conflicts national or regional are profound risk and risks for trafficking for children and women. Also, that's important to share that this displaced population, not all displaced people are back to Nagorno-Karabakh as the conflict is not settled, and most of them are within the territory of Armenia, so they are particularly vulnerable to traffickers who appear to offer life-saving access. They can offer employment opportunities. And last year we had a case that 31 one case of trafficking investigated by law enforcement authorities, that a trafficker engaged 31 people and within the promising that they will provide information regarding the people in hostages and different kind of things. So we know that war and after war situation could have such kind of risks for traffickers to use this situation and vulnerability of displaced people. But also I would like to speak about regional or global issue, which is Ukraine-Russian war, and we should say that we had both from Ukraine and Russians, not people who moved to Armenia for work reasons as migrants, not as asylum seekers, but also refugees from Ukraine. We had already 200, and now it's growing number. Ukraine citizens have already requested asylum in Armenia, but we also have huge community of Russian citizens who are work migrants, mostly in IT sector, but there is a need for further survey to understand what other spheres and employment areas that these migrants are involved in Armenia. So we see that these are important factors that should be considered in the region and in the country context particularly. Thank you. Next slide, please. And thank you. Presenting the efforts by the government of Armenia to support victims. This is the country context, already the country structures that are in place. So the project started in 2021, but it's important to take consideration what are the structures have been established before and what is the country progress addressing the trafficking as a health issue, as a social public health issue. So it is important to mention that the 4 Ps are in place with a stronger anti-trafficking legislation, which is the main law on identification of victims support and providing support to victims. There is a strong public awareness component within the National Action Plan, 3 years plan, adopted every 3 years approved by the government of Armenia, and the structural layers of the whole anti-trafficking or counter-trafficking response are these 4 Ps, which is prevention, protection, prosecution, and of course partnership. Covering the issue of the structures, it's important to say that there are 3 structures here that may also have in other countries as well. I suppose that there are similar structures in the countries, in other countries as well. So there are 3 structures, which is the national structure. It is council, trafficking council under Prime Minister's office. This is the national board. There is a working group, which is inter-ministerial or interagency board, and it also provides national implementation and reporting to the council. And there is also in place identification committee, which is interagency, more professional commission to identify and to provide support and referral to all victims and assumed victims. So when the project started, it is very important to know that there were two main activities to capture or to figure out the situation in the country, the structures existing, and the legislation. Next slide, please. Yes, within the project, there were two, as I said, it was important to say that there were two key assessments done within D4I project. The first was the landscape assessment, and the landscape assessment was the first step towards understanding and designing or scoping the measuring the issue within the existing structures and within the existing legislation. And the more profound assessment was done, started in February and ended in July, and we published our report as Counter-Trafficking Expert Assessment Report. So this report actually is the key, is the main key document for the last, I would say, 6 years that has been done in Armenia in the counter-trafficking sphere. It's important to mention that in Armenia, two USAID State Department reports and Council of Europe's Greta reports are in place, but the recent report were done in 2018 before the COVID, and this is our assessment report is the first one after COVID and also after national and regional conflicts. So we also consider the risks and the factors that are existing now. So what was the key approach in the report? That the report tries to assess or comes to answer to the main question, to the main tool, which is the National Action Plan, to evaluate the government's or to assess the government's efforts within the counter-trafficking, but also to provide understanding for the next year's strategy planning. So the assessment report, it was a good measurable tool to understand how many activities are planned for each sector. And we found out that there are two activities directly implemented by Ministry of Health, and 4 activities implemented by the Health and Labor Inspector Body. It is, of course, we need to recognize or acknowledge that 2 activities implemented by Ministry of Health are good, but not sufficient to ensure the whole public health perspective and the equity of services for victims. But it's important to mention that they are in place, and also they are kind of in synergy with support programs delivered by the Ministry of Labor and Social Affairs. So the country response is to, and our progress, the project response and project perspective is to provide equally usable approach from criminal justice approach, moving to also public equity approach. And by this synergy, support and strengthen country response to victims and country response to health issues. I think I covered our overall the situation, and now coming to the challenges remaining. The challenges remaining are still, of course, I think each country has these challenges, but these challenges can also be in place because, as I said, we now are facing the serious risk of conflicts and after COVID situation. And we take into consideration that new national action plan should be more strengthened and more targeted to these challenges. The first, timely healthcare access. It's important to take into consideration that the victims of assumed victims are not aware or do not have direct access financially, technically, mentally to use and to enjoy their free Medicare, even if it is in place. It's important to say, yes, this free Medicare is in place for assumed trafficked and identified traffic victims, but it is in place when they are identified and when the cases are registered. Ideally, all victims should enjoy primary access to primary health counseling, shelter, allowing them to recoup their trafficking experiences. But in practice, many cases are not covered or are not opened. Many cases are still need to be identified because lack of evidence, and many cases are still need to be referred and to assessed as trafficking cases or cases of forced labor. So the second issue is the mental health service provision. Mental health issues are very important, especially taking into account minors' needs when there is a brain development issue, access to education, and when they do not have for a long time, they do not go to school, they do not have this development activities, sports, art, different kind of creativity activities. They may also have low or a lack of development in the brain and other kind of mentally or psychosomatic issues, and also mental health issues. Also, evidence gap in the field of trafficking. It's really important to highlight that anti-trafficking or counter-trafficking field lacks a fundamental base of evidence that estimates the impact of efforts on planned outcomes, and different methods should be used to understand the impact, output, and outcomes correlation. And sometimes there are activities that do not bring to the desired outcomes and incomes. This is all about, of course, the strategy planning, but when there is a lack of data, lack of referrals, lack of data sources and sharing between different agencies, the planned activities may not really address the issue and to show the real picture. Linking health and justice programming. We found that this is a very core challenge, and this challenge also can increase the misassessment or misunderstanding or lack of communication between health sector, social sector, and law enforcement justice sector. So there is a need, strong need to further explore partnership communication to improve the healthcare provision at frontline level, community level, where, for example, primary health workers should see, understand, and screen the first signs of health, assumed trafficking cases, and also they should have the practice to refer these cases to law enforcement, for example, patrol policing or community policies. So this is a prevention activity, but also proper intervention activity that should be integrated in the long-term policies as well. Thank you. I think I addressed main challenges.
Great. Thank you, Gayane. We are going to move into the question and answer period. I've prepared a few questions for Gayane and Lillian to start. So we'll go through those. And then, of course, if there's other questions from those listening in, please drop them into the Q&A section. So then we can move to those after. Great. So my first question is to Gayane. How can we ensure CTIP efforts are integrated in health programming?
Thank you, Matt. Yes, this is the most profound and dominant question and the conceptual question that has no unique answer, and it's a real discourse to start or disseminate or to think about. But starting or working or continuing this synergy effort within our D4I program, we came to the conclusion that sometimes health outcomes and health issues are under acknowledged and under recognized within agencies and policymakers. And it is important to show and to visualize and to share the information that adverse health outcomes are common for all victims of trafficking and may continue. They may have effect to experience these outcomes for a long-term period, life period sometimes. And this is disabling outcomes, having physical and psychological harm to their health and overall to their well-being. When we speak about, for example, sex trafficking, we should be very keen to sexually transmitted infections, infertility, abortions. When we speak about minors, we should take into consideration brain development issues, low educational attainment, in future lifetime employment, less opportunities for a lifetime. So these are indicators that maybe not very not evidence or not measured in the policy level. So we do not know how many people had, for example, psychological harm, how many young people did not go to school. We cannot measure kind of mental health issues sometimes, but when we do not measure these issues, we cannot transform into policy making. So the first approach that it's important to make these health indicators, health issues, or information and data on health issues available to not only health people, healthcare policymakers, but also to overall working in working group level. It is the interagency working different ministries, and in council level, this is the government that should be aware that public health has planning has very core connection. But from other side, from the health perspective side, how should the health perspective or the Ministry of Health should integrate the planning? How should integrate the CTIP effort? It is also important to understand that while providing these free Medicare services to victims, we do not cover the issue because it is in place. It is in place for people who are identified, who are referred, but the ones that are not recognized or acknowledged or are in hinder positions, so they are out of health programming, so they are not numbers nor people in health programming. So I think that it's important to use as an advocacy tool and as a measure to synergize these efforts, to have better communication within these two fields and to have better data on health situation of trafficked victims and assumed traffickers. And assumed victims. And within speaking about health, we should consider physical health, but also mental health issues.
Great, thank you, Gayane. And I think you led a bit into my other question, which is how can we support governments to ensure progress in CTIP? So maybe you could elaborate a bit on some of the support provided to governments.
I will continue, or my colleague would like also to share
Yeah,
international
go ahead. Go
perspective.
ahead. Yeah,
Okay,
if you have anything to
will-
add, and then
yeah,
Lillian.
yeah.
Yeah.
I will provide from country perspective, and my colleague, of course, will share more international discourse on the situation. I think it's really important to this capacitation of the national actors, understanding that the first understanding the problem. I remember there never have been a counter-trafficking conference that is presented from public health or health equity perspective. And this is a very important thing to know. I know that, for example, different universities which have public health faculties have tried to get information, for example, to use field surveys to collect data from people who are who visited hospitals or something. But even the methodology is important to understand how we can reach to the real victims or to the real ones that need more access to their help. So I think this is important to know that academic institutions and the country, the government should work together. And when we have this communication, interagency, engagement, and we have this perspective that public health is overall also, the city is also about public health. So this is a new perspective that we should work on it to activate this debate, this discourse, this paradigm within the country. And we have 1 year on working with better communication with the government, within the agencies, also promoting public health perspective.
Great. Thank you, Gayane. I'm also looking at the questions that we've received, and I think one is related to the support of government. So I'm going to read that one, and you and or Lillian could respond. The question is, how do you think the country can manage the data to avoid underreporting? And is there a way to encourage appropriate authority to document cases of CTIP internally?
This is the issue that now we are working on it, that the underreported cases are in the place because there are sometimes we do not have indicators in the systems. In some ministries, there are no databases or data sources to assess or to understand. For example, and I see there is a question about how community-based health facility can provide the data. The main issue that if they are not specially trained on counter-trafficking or risks of trafficking, actually they cannot do this kind of screening. And there is a lack of data, and that's why it's important to develop a kind of indicators for different workers. And for example, for social workers, there is a list of indicators where there is no, and the government of Armenia, due to our support to the government, there has been a guideline developed with another actor, World Vision, supported by the State Department, that supports the labor inspections and health inspections to preliminary identify the case. It's a kind of criteria identification guideline, how to recognize, how to screen, or how to make an initial identification.
Great. Lillian, anything to add on government support?
I just wanted maybe to point out 2 things. One, about data and ensuring that all data collected, regardless of its complexity, should be disaggregated by basic parameters. That will be, I can say, like a first building block of countries or nations getting to know what is the complexity of the trafficking in person situation. So for us to be able to develop national data collection systems in trafficking in persons, there are efforts to improve data. Really, I think that's still something that is needed. And then in terms of government, I would also want to mention how we can support government. I would also like to say that investing in international cooperation to strengthen response, that is around partnerships. The other one is if governments can address poverty and lack of, say, equal opportunities, because when governments invest in people such as education, jobs, part of the what we can call the systemic solutions, then which really rely on broader partnerships between government, public, civil societies to be able to counter some of the measures that can push people to being trafficked. Lastly, I want to say also it will be of interest if governments can invest in national capacities. Today we were talking about how to better integrate healthcare in counter-trafficking programming. So better training of service providers like the healthcare workers, the police, to be able to identify or to detect a victim of trafficking and even enhance their support, I think is very key. Let me keep it at that in terms of support to governments.
Great. Thanks, Lillian. And in the interest of time, we're going to move to the final sort of recommendations. Over to you, Lillian.
Quickly, I'll mention that as part of wrapping up policy, healthcare providers really are in this unique position to identify and provide for them either the physical or psychological care. Policymakers should look at how the healthcare system not only can serve victims, but help solve the trafficking problem. I think I've mentioned it through identification during service provision and making referrals to the other points of care like police or to shelters. Two, the need to explore partnerships to improve healthcare provision and prevention among the victims between the health sector and the TIP sector. It will be important if governments can equip health professionals with education, even TIP education, provide tools, provide an active social service partnership where government can be able to assist vulnerable patients or vulnerable victims. And finally, the health sector, being a valuable site for interventions, should focus on protecting an individual's right to access to healthcare services and can be key to identifying the trafficked person in healthcare settings or even refer for additional service. Thanks.
Thank you, Lillian. So that concludes our session. We really appreciate you joining and the questions. And yeah, thanks and have a good day, everyone.